Hi guys, my name is April. This is Baby, and Baby's my first parrot. And last night when I got home, he was at the bottom of the cage and he had one eye closed. I don't know if he's had a stroke. I just don't know. I don't know, maybe there's something wrong with the eye, but I'm really concerned because this is not Baby, and Puffy was just totally stressed. He was trying to preen Baby, and normally Baby preens Puffy, so he has an appointment with Dr. Cecil in 2 hours, who's an avian veterinarian. I don't want to take him just anywhere. I don't want to take him to an emergency room right now. And we just have 2 more hours and then he's going to get top care. So I just got to get him through that. But you guys, I can't help to think that I caused this. You know, when I got Baby, many decades ago, I was a kid and there wasn't YouTube. There wasn't like information out there. It was so limited. And when I bought him from the pet shop, and yes, I bought him, I also didn't know there was a parrot crisis, and there may not have been back then, right? They gave me seed and a tiny little cage, and they said, this is how you do it. So I figured they were the experts, right? But they so are not. So Baby was on a seed diet and he ate fattening foods for a couple years because I didn't know I was a child. And I'm just so worried about him right now. It's so important, you guys, that you educate yourself and you get your birds on a healthy diet. And Baby's been on a healthy diet for 20 plus years now, but still I'm going, please God, don't let this short time in his life come back and cause trouble for him. And please don't take him. So that's what's happening. And we're going to take him to the vet. But then also there's a Senegal parrot that needs rescue right now at the Humane Society, and it's just basically this morning it's just exploding. Like it's just terrible. So my number one concern right now is get Baby to the vet, and then we'll take it from there.
So does he get any fatty food still?
Not really. Okay. He's on pellets and fresh food, lots of quinoa, pasta.
And all his blood work has been good.
It's been a year since blood work, but it always comes out perfect. The cholesterol is perfect.
Okay, good. I know.
But do whatever you need to do, Dr. Cecil.
Yeah, I don't think we need to repeat it.
Okay.
Hold on, you're okay. I gotta listen. I know, you're doing great. Hold on, buddy. Okay. That sounds good.
He's a messy eater, so his nostrils always get food in there. He's a little pig.
You're a little pig. She said it on me.
Wow, so they can get cataracts at this age. I had no idea.
But now I can see in this one too, there's something on the surface.
Yeah, and that is, gosh, ever since I could remember he's had that.
Yeah. I know, you're okay. And so you've seen these for a while?
I have.
Okay.
Probably, gosh, 20 years or maybe. You know, as I'm getting older, time is just clumped together. Doing good, Baby.
You're doing great. Do one more thing. Why are you so snotty? Yeah.
He gets a lot of food in those nostrils.
That way you're snotty.
Yeah, he's a food bowl diver.
So I think he's got some maybe immature cataract on the right eye.
Okay.
I think he has a little bit of. Look at this.
There it is, right there. Oh, boo boo. Oh, he just pooped. Let's look how the poops look.
Keep this. I'm trying to poop over here. And then I think he has these deposits on his cornea.
Okay.
And you know, those deposits can be lipids or cholesterols that I've heard in the past. I guess there are other things that can crystallize and cause that too. I think the only way you're probably going to get a better definition of inside and the surface of the eye is probably see a veterinary ophthalmologist.
Do you have anyone you would recommend?
I do.
Oh, you do? Okay.
And actually, she's here now.
Oh.
I don't know if she has time.
Okay.
But I can go ask and see if she does.
Okay.
And but I think, you know, I guess the reason to do something like that would be two or threefold. You know, one is to have a diagnosis.
Right.
Two is there anything that can be medically applied to the eye drops that are going to help with this? And third is, and I'm going to say if they progress, is there a surgical option?
Mm-hmm.
And I'm sure there is. Just I think that they have that knowledge base to know what is going to work best.
Okay.
So let me just jog over there and see if she has time today. They're only here for short periods of time.
Okay.
Like, you know, I want to see Tuesday and Thursday mornings.
So if she can, but if he has to have surgery, you're not here for the surgeries, or do they do the surgery here?
They don't.
Okay.
Yeah, they do it at their facility. Yeah, I mean, we'll figure all that out.
Okay.
But
Okay.
Yeah, that's
and it hasn't progressed in years, but what concerns me, he closing it, so I'm like, what's happening?
And maybe it might just be something that when we're doing that, it may be just some standard anti-inflammatory drops that just makes it more comfortable, and you're kind of leapfrogging onto that, especially if it's not developing yet. Yeah.
Okay.
Yeah. Okay. Let me go ask them real quick though.
Wow.
Okay?
Thank you.
You're welcome.
Did you hear that? You doing okay? Okay, so we're at the ophthalmologist now, and they're gonna have to test his eye pressure, so I'm not sure how that's gonna go. Because he's pretty, oh, he just pooped. Yeah, he's you know, he's nervous, you guys. He's never been here before, but you know what, I want to see if there's anything we can do, if there's something bad going on with his eye, you know, just kind of stay on top of this situation. Hi guys, we're home, and baby's exhausted. It was a big day for him, or a big morning. He actually got into the ophthalmologist, so I'm really happy about that. They squeezed him in because they're like really concerned about his eye. They did a full eye exam. We're still not quite sure what's going on. He does have the beginning stages of cataracts, which I'm just like floored right now. It's just, he's 26 years old, like, but they're calling him middle age, so I'm just kind of freaking out. We don't know if it's from hereditary. We don't know what the cause of this is, but on his other eye, he does have like these dots, and we don't know if it was from those 2 years of diet. I just don't know, you guys. So what's going to happen is he's going to be on these eye drops for a while, and we're hoping the eye drops will take down the inflammation, which will relax his eye, and he won't be in pain anymore. You okay, boo-boo? But as you can see, he's just really out of it. Like, this eye's open and that eye's closed. So I'm praying to God that these eye drops work, because he's just favoring that eye. But good news is he did not have a stroke, right? And it's his eye. Look how tired he is. Right, baby? Oh, he's so cute. He's like my first bird. I can't let anything bad happen to him. So, alright guys, thank you for watching this video, and we love you. This is life with parrots. You just never know what's going to happen. You just have to be super flexible.